Good morning or afternoon, depending on where you're joining us from, and welcome to our webinar, The State of Firearm Laws, Data for Building a Culture of Health Around Gun Policy. I'm Erin Hagan, the Deputy Director for Evidence for Action, and I'll be your moderator today. We're so excited to bring you this new data and information that will help lay the foundation for future research exploring which state policies work the best to reduce gun violence and improve population health and well-being. Evidence for Action is a national program of the Robert Wood Johnson Foundation committed to developing the evidence base to align with RWJF's vision of building a culture of health across the country. Our mission at Evidence for Action, or E4A, is to fund rigorous research examining which strategies are most effective in improving population health, well-being, and equity. Gun violence is increasingly recognized as a public health issue by numerous national organizations, both within and outside of the health sector. In the United States, more than 30,000 people die from gun violence each year, which is higher than the number of people dying from other more commonly discussed diseases such as HIV or hypertension and other public health issues. Yet many of these other conditions receive significantly more public health attention and funding. Gun violence research is substantially underfunded and understudied relative to other leading causes of death, largely due to federal restrictions on the use of funds to study gun violence. As a result, there is a real lack of evidence available for policymakers to utilize in the development and implementation of effective evidence-based policies to reduce gun violence. It's really important that we not just look at gun violence as a criminal problem. This study that we'll be talking with you more about today is trying to change the paradigm to think of gun violence as a public health problem and understand the underlying gun culture. At Evidence for Action, we believe in evidence-based policies and programs, and we fund the research needed to build that evidence base. Today, we'll be joined by Dr. Michael Siegel, who is a professor in the Community Health Science Department of the Boston University School of Public Health. Dr. Siegel will share preliminary insights resulting from the process of identifying and categorizing state firearm provisions, discuss the motivations behind doing this work and how the results in database may drive future policy change, describe various features and functionalities of a website that has been launched to share this data publicly with you and others, and of course answer your questions at the end of the time. We're also joined by Mighty Fine, who is a social epidemiologist by training and is currently the acting director of the Center for Professional Development, Public Health Systems and Partnerships at the American Public Health Association. In this role, Mighty oversees APHA's portfolios on continuing education, workforce development, public health practice, and global health. His work stems across various aspects of public health subject matter, and he employs a special focus on injury and violence, maternal and family health, and chronic disease prevention. And today, Mighty will be talking with us more about how this database specifically and data like this in general can be used to inform better policy. So with that, Mike, let me turn to you to talk us through your work.
Well, thanks, Erin, and thank you, everyone, for being with us. First, I just want to acknowledge the support for this project from the Foundation, from the Evidence for Action program, and just want to note that the views expressed here do not necessarily reflect those of the Foundation. So what is the problem? If we look at the trends in firearm mortality in the U.S. over the past decade, you can see that there's basically been very little change. It's been relatively flat, and in fact, in the last year, from 2014 to 2015, there's actually been an increase in both firearm homicide and firearm suicide. And in fact, the change in the increase from 2014 to 2015 is the largest annual increase that we've seen in the last 35 years. The rate of firearm homicide increased in every state except one. So the question is, what has Congress done about this? So this is a list of laws that were enacted by Congress to reduce firearm violence over the last 10 years. And if you're wondering whether you're seeing the proper slide because you don't see anything, this is in fact the list. There's nothing. Congress has literally not passed a single law in the past decade to address the firearm violence problem. So the action, in the absence of federal regulation, the action is really all at the state level. And professors Daniel Webster and John Vernick from Johns Hopkins have highlighted this in saying that the states have become the primary forum for innovation in gun laws. So it's really important to understand what is happening at the state level, what laws are states enacting, and are those laws working. So I want to give you a little bit of a summary of the types of laws that states are enacting. There's a broad range of policies that states can enact to regulate firearms. And this is from a scorecard that the Law Center to Prevent Gun Violence in San Francisco puts out, summarizing 8 different categories of laws. And these range from child access prevention laws that try to reduce child injury, laws that establish what types of people who are at high risk for violence cannot own firearms, the open carry of firearms, prohibiting access for domestic violence offenders, regulations dealing with concealed carry of firearms, reporting of mental health issues to databases, background checks for private sales of firearms, waiting periods before gun transfers. These are 8 different areas, and it's actually just a small slice of the types of regulations that states are passing. But if we look at this is a chart that the Law Center put together showing all of the different states here, and for each state this is color-coded to show what the status of their laws are for each of these different categories. So everything is color-coded in terms of these different colors representing each type of law. And so you can see, looking at this, that it's a complete mess. It's this chart, I can't make any sense of this. It's almost impossible to follow what this all means. And I wanted to show you this because I think it kind of demonstrates right now our understanding of what's going on, what is the landscape of firearm legislation across states in the U.S. It's a mess. Nobody has really cataloged this in a way that makes it easy to understand. And it's really, the other thing that this shows is that there's so many different types of laws that if you're a state policymaker or public health advocate trying to figure out what laws to promote, there's so many different types of laws, so much variation that it's not clear what action you should take or what you should recommend. So it's really important that we understand what state laws are the most effective in reducing firearm violence. And to do this, we really need to have a longitudinal database of laws over an extended period of time so that we can answer the question. The type of research that would need to be done to answer this question is looking at the relationship between the enactment of laws and changes in firearm homicide or suicide rates over a long period of time. You can't just take a snapshot of 1 or 2 years. And before this project, there was no longitudinal database of state firearm laws that covered an extended period of time. There are certainly databases out there, such as the one I just showed you from the Law Center. There's also a Brady campaign scorecard, which is done every year. So there are databases out there that can give you a snapshot at the current time of what the state laws are. But there's really no existing source to go back over a long period of time and look at the trends in these laws. So with funding from the Robert Wood Johnson Foundation, we developed a comprehensive database of state firearm laws. It covers 133 different types of provisions in state firearm law, covering 14 different categories. it covers all 50 states. It covers every single year from 1991 to the present. It is up to date as of today, and it will be updated continuously. So as states pass new legislation, the database will be updated so that people can at any given point in time get the current status of the laws. And very briefly, the methods that we used were to code 100 of the provisions. We searched each law individually using a database called the Thomson-Reuters Westlaw by actually reading the state statutes and coding them directly. We cross-checked our coding with pretty much all of the previous published data, others who have looked into this issue and have coded laws. We also coded an additional 33 laws from data that was provided by Everytown for gun safety, which themselves is putting together a similar database, but that isn't quite available yet. So I want to summarize some of the major findings from our research. And the first thing that became very apparent is the tremendous variation in firearm laws across states. So this shows you the variation across the U.S. in terms of the total number of provisions that each state had in place in 1991. And there is a total possible of 133. You can see that back in 1991 there was a tremendous variation, going from as few as 3 provisions in a state like Montana to 58 provisions in California. And this is really, we see a lot of disparities in health laws and health protection across states, but this is like nothing that we typically see. To see about a 20-fold difference in the number of laws that different states have. In 2016, we see that there is still that drastic variation, but it's become even more marked. So now the low in terms of the number of laws is 4 in states like Montana and Idaho, going to a high of now 104 in California. And states like Massachusetts have 100 laws, Connecticut is 89. So again, there's a vast discrepancy in the number of laws. And if you look at the change in the number of laws over time, there is a really striking finding, which is that, again, there's this huge disparity. Some states, like California, passed 46 different laws. Connecticut actually passed 62 laws during this period from 1991 to 2016. On the other hand, there are a lot of states that actually went backwards in the sense that they repealed more laws than they enacted. So, for example, the state of Missouri actually got rid of 9 of the provisions that were existing in 1991. And so they lost a total of 9 net law provisions over time. You can see that there were a large number of states that either lost laws, repealed laws, or enacted a very small number of laws. In a very small number of states, mostly in the West Coast and in the Northeast, that enacted a large number of laws during this time period. So there were a number of trends that we found. Oh, this is just to show you here the discrepancy between the top 5 states in 1991 in terms of the number of laws and the trends over time. So for those states that were already in the top 5, they enacted a large number of laws over time. You can see that the average goes from about 50 in 1991 up to close to 80 in 2017. But the 5 states that were at the bottom in 1991 basically haven't done anything. They averaged about 5 laws in 1991, and they're still at about 5 laws in 2017. So not only is there a disparity between states, but the disparity has grown over time. There are a number of important trends that we identified in terms of the types of laws that are being passed. And the first trend is that there was an increasing number of laws passed specifically for the purposes of expanding the use or scope of the use of guns. And this shows you stand your ground laws. These are laws which basically say that a person can use a gun as a first line of defense when they are seriously threatened without a duty to retreat, as long as they're in any place where they're allowed to be. And you can see that started out with actually 0 laws in 1991, but starting around 2005, there was this marked increase, and we're up to about 26 laws today. So about half of the states now have these stand your ground laws. Another trend is immunity laws. Immunity laws are laws which prohibit cities and local governments from suing the gun manufacturers, or which basically prohibit private lawsuits against gun manufacturers. And you can see starting around 1998, there was a dramatic increase in these laws, and the majority of states now have these immunity laws in place. Another trend along this line is the increase in permitless carry laws. These are laws that allow citizens to carry guns concealed without any permit whatsoever. And you can see that actually the trend has been striking since 2014. So in the last 3 years alone, the number of states with not requiring any permit to carry a concealed weapon has gone from 4 all the way up to 12. Similarly, there has been an increase in non-discretionary concealed carry permitting laws. And this means that the states do require that you have a permit to carry a concealed weapon, but the state has no discretion in terms of denying your permit. So unless you have a criminal record, the state cannot deny you a permit to carry a concealed weapon. And you can see the number of states that enacted these laws rose drastically from only about 16 in 1991 to we're up to about 41 states now in 2017 that have these non-discretionary concealed carry permit laws. Another trend has been increase in states that are allowing the carry of concealed weapons on college campuses. And you can see that back in the early 1990s, there was actually a trend of a decrease in these campus carry laws. They remained steady, but in the last few years, they're starting to resurface again. What about the laws that are intended to prevent firearm violence rather than to protect manufacturers? Well, the trend in universal background check laws looks like there's been a significant increase since about 2012, but keep in mind the total scale here. It only goes up to 14. So there's only 13 states right now in 2017 that have universal background checks, meaning that in the other 37 states, it's possible to buy a firearm without having any background check into your criminal history to see whether you are actually prohibited by federal law from possessing a firearm. And this is the trend in firearm permitting laws. So these are laws that require a person to have a permit in order to purchase or possess a gun. And you can see that the number of states that require permits for handguns is relatively small and hasn't really done much since 1991. There's only about 13 states now that require permits to carry a firearm, a handgun. And for all firearms, it's even lower. So there are only 8 states today that require that to carry a long gun, you must have a permit, and there's been very little change in that. Well, there is one area where there has been a striking increase in the number of laws adopted across the states, and that's in the area of laws that are designed to prevent domestic violence offenders from possessing firearms. There's been a pretty large increase in state laws that prohibit people who have been convicted of committing misdemeanor crimes of domestic violence from possessing firearms. And there are more than half the states have these laws in place in 2017. So there are a number of states that, even though they have a low number of firearm laws overall, have enacted these specific protections for victims of domestic violence. Similarly, there's been an increase in laws that prevent people who are subject to domestic violence-related restraining orders from possessing guns. And you can see, again, an increase to the point that the majority of states, about 27 today in 2017, have such laws in place. Now, one of the benefits of our database is that it goes into tremendous detail on the nature of the laws and the specific provisions, including how these laws are enforced. And one of the findings that came out of this database, because of the detail with which we coded the laws, was that it gets a little more complex than just looking at the total number of laws. So here presents a very positive picture showing this large increase in the number of states that don't allow people who've committed domestic violence to own a firearm. However, only a small number of those states require that the offender actually surrender their firearm. So these are the states that require not only that a person who has been convicted of a crime of domestic violence is not allowed to carry a firearm, but the law mandates that they must actually surrender or turn in the firearms that they already have in their possession. And so you can see there's a large gap here, a large number of states which have these laws in place but really don't have the ability to enforce the law, because it's totally up to the offender as to whether they're going to voluntarily surrender their guns. There's no requirement that they do so, even though legally they're not entitled to possess those weapons. And it's even worse than that, because this shows you the number of states that actually have what we call confiscation laws, which means that law enforcement is authorized to actually take the weapons away from that individual, from the offender, if they don't voluntarily surrender the firearms. So you can see that there's only a small number of states, of all these states that have this prohibition, only a small number of states really have the teeth in their laws that they can enforce the law by actually taking guns from the offender to ensure that the law is actually being enforced. And we found a similar picture with the restrictions on people who are subject to domestic violence restraining orders. There are a large number of states that do not allow subjects of domestic violence restraining orders to possess guns, but a much smaller number of those states actually require that those offenders turn in the guns they already have, and a much smaller number require or allow law enforcement to actually confiscate weapons that have not been surrendered voluntarily. So what are the values of this data? First, they can help researchers study which laws are effective, which is really their main purpose. But secondly, they can also help identify what specific law provisions are necessary to have an impact on gun violence. And third, they can help reveal important trends that may reflect changing social norms or specific lobbying campaigns. So a minute ago, we saw the trend in the Stand Your Ground laws, and we saw this tremendous increase starting in 2005. And it turns out that that's not a coincidence, but it reflects a specific lobbying campaign. And in fact, the NRA, through the American Legislative Exchange Council, started a concerted campaign in 2005. They actually developed a model law and started lobbying for the passage of this law throughout the country. And so pretty much every Stand Your Ground law that's been enacted since 2005 has used the exact same language. That was one of the things that was striking in our research. We saw the exact same wording, the exact same language in law after law across the states. And so this was interesting because it pointed us to the fact that this was a specific lobbying campaign. It wasn't just coincidence that states were thinking about this issue. And it also reflects a change in social norms. And although we don't know which came first, we don't know whether it's the laws that caused the change in social norms or the change in social norms that created a demand for these laws, there is a definite correlation here. You can see that the number of people, the percentage of gun owners who reported hunting and sport as the primary reasons for them to possess guns was pretty much stable between 2000 and 2005. But since 2005, at the same time as these stand your ground laws have proliferated, there's been a marked decrease. And at the same time, there's been an increase since 2004 in the percentage of gun owners who say that the primary reason they own guns is for self-defense. So laws may reflect social norms. They also might affect those norms. It can go in both directions. So overall, the conclusions of our work is that first, there's a striking disparity between states in the number of firearm laws. And secondly, there's an equally striking disparity in the adoption of new firearm laws over time, which has led to an even greater disparity in gun regulation across the states. There's also an increasing trend in laws that expand the scope of allowable possession and use of firearms. There's an increasing trend in laws that protect the firearms industry. And at the same time, very few states have closed the loopholes that allow people to purchase guns without a background check. And very few states require permits for people to purchase and possess firearms. And then finally, there has been an increasing trend in the enactment of domestic violence-related gun laws, but very few of these laws really have adequate provisions for enforcement. So at this point, I just want to give you a very brief demonstration of the website to show you how you can track laws and look up laws on your own using this website. So this is the website here, and there are two main features. There is the law data pages, and then there's the state-by-state pages. So I'll start with the law data pages. This page allows you to do two things. First, it will present a map, and the map will basically show you in any given year the total number of firearm provisions in each state out of the 133 total. So this is the year 2016. And using this cursor here, you can change to any year, and it will tell you, the map will change to reflect the number of laws that were in place in each of the states in that year. So we go back to 1991, and you can see that there was an increase looking from 91 to 2016. In fact, we have this going up to the present day in 2017. So this is the total number of laws in each state as we sit here today. The second function on this page is the table function. And what that will do is it will display all of the states and whatever year you're interested in, and it will list all of the different provisions that are either in place or not with these zeros or ones. A 1 means that that particular provision is in place or was in place in that state. A 0 means that it was not in place. And you can actually filter it to look at an individual state. If you were interested, say, in just what's going on in Alabama, you could just click on Alabama, and then it will show you here what the codes are for each of the different variables. You can also filter it by the type of law, by the category of law, or by the specific provision. There is a description of each of the categories of laws here, so you can click and look at any particular category to see what the different provisions are, and they're explained here. Now the state-by-state pages allow you to look at particular states and to get information on kind of a quick snapshot in any given year of the firearm-related homicide and suicide rate, along with the total number of state gun laws, and the specific provisions that were in place in that year. So this is 2017 for Alabama. We can let's look at a state that has a lot of laws. So if we go to California, here's a list of all the different provisions that California has. So you can see that there's an extensive number of laws. And it will do this for any state in any given year. It will also, if you go to a year prior to 2016, if we just go back in time here to 1999, it will give you the status of the current status of the law. So if it says current, it means that that law that was present in 1999 is still present now. And if it says repealed, it means that that law is no longer in place. If we look at Alabama, we go back to 1991, you can see that there were a large number of provisions that they had in place in 1991 that have subsequently been repealed. In fact, most of these laws have been repealed. So you can see a change in both directions, both an increase in laws and a decrease in laws. So that's a brief demonstration. Just a couple other things on the site that I wanted to show you. We do have a report that summarizes trends in the firearm laws over time, and it explains the database, and you just click on Read the Report, and you can download the report. And if you want to download the database itself, you can do that using the Visualization Table tab, and down at the bottom of the page, you can download the entire database. And then finally, you can download the code book from the law data page by just clicking here on Download the Code Book, and it will bring up an Excel spreadsheet that basically describes each of the different provisions and gives you detail on what is in each of the different laws. So with that, I will turn it back to Erin, and of course be very happy to answer any questions that people have after Mighty speaks.
Great. Thanks so much, Mike. This is such a great resource for the field. And Mighty, we're happy to turn to you now and hear more about how you think it really might be put into practice in an advocacy and policy setting.
Sure thing, and thanks to Mike for that great overview of the changing landscape of U.S. gun policy. And obviously I'm pleased to be on the call today to represent APHA, as I have both a personal and professional interest in gun violence prevention. And for those of you on the call who may not know, I wanted to point out that APHA is striving somewhat ambitiously for the U.S. to become the healthiest nation in one generation. And we plan to get there through an initiative we label Generation Public Health. And essentially, this is a national movement of people, communities, and organizations working to ensure conditions where everybody has the opportunity to be healthy. And as I mentioned, our overall vision is to create the healthiest nation in one generation. And for us to achieve this feat, we clearly have to address the impact of gun violence in this country. So hopefully it should be no surprise that at APHA we are fans of evidence, science, and data, so we are clearly in support of databases like this. And we support a public health approach to gun violence prevention, or prevention in general, and or violence prevention in general. We address the issues using the traditional public health paradigm, that is defining the problem, identifying the risk and protective factors, developing and testing prevention strategies, and of course assuring widespread adoption. And when we think of widespread adoption, policy is a clear component of that piece of the puzzle. And if we harken back to some of the greatest public health achievements, we'll note the critical component that policy and legislation played in those successes, which brings me to advocacy and the utilization of this database. I think even not just for advocates, but public health practitioners and researchers alike will find the utility here. As Mike mentioned, we know there's some, at the federal level, legislation is lagging and there's not much traction there, but we have seen some movement on the local and state levels. And, you know, from our perspective, an assessment of state firearm policies provides an opportunity to better understand how these laws impact violence in these states. And this database helps to provide a more comprehensive picture, helping us to know not only the laws, but when they were enacted in relation to gun violence in that state. If they were repealed, I think that's also a critical point for advocates to pay attention to, and really just assessing the data in confluence with gun injury and gun death data. It helps us to give a more firm stance on what laws we're supporting and why we're supporting them. It adds more luster to our argument, I think. I think, as Mike alluded to as well, we know that states not only vary in the incidence of gun violence, the amount and types of laws on the books, but there's also states vary in their culture of gun violence and gun utilization and access as well. And I feel that this resource helps to add to that conversation. Again, looking at what laws are on the books for what states and how that plays out in the overall burden of gun violence. And I think as advocates, those are the data that we need to be equipped with. It's important, as I mentioned as well, to look at the laws that have been repealed and see how that has impacted gun violence rates as well. As one of the issues that we advocate on in the groups that we've worked with, where I think this database is also critical, is taking into account gun trafficking and the amount of guns that go across state borders, and acknowledging and recognizing the differences in gun laws in those border states and how that plays out in homicide and suicide in those states. And I think that's a critical feature of this database that will help in advocacy efforts. And we know when we advocate for public policies, it's usually a layered process. We tell stories of our experiences. We tell other people's stories. We share research, and obviously we share data in an effort to convey our message and the need to do something to address a public health burden, and in this instance, gun violence. So I feel that this database helps to tell a more complete picture of gun violence in America. It's something new. It's something novel. We haven't seen it before. I know as an advocate and an epidemiologist, this is very exciting. I think it will help us to advocate for laws that have been shown to be more effective. And again, it gives us the validation that we need in advocacy, in our advocacy efforts. We at APHA believe that violence is preventable and not inevitable, and I think tools like this database help us to validate that claim. We not only provide the data, but we can explain it as well using this resource. And it also should help us to understand the impact of these laws on the community at large. I think another useful aspect of this database, in some instances, I wouldn't say provide solutions, but at least it provides models for states that have more comprehensive gun laws, and we see a lower incidence of gun violence. I think that's a great advocacy aspect in this situation. I think also what it helps us to do is that we recognize that gun violence cannot be solved by public health alone, and this database helps us to engage with other sectors and showcase what their stake in prevention is. Moreover, the law enforcement, faith-based communities, and business communities to think about how these laws, or the lack thereof, impact the work that they're doing in the overall health of the state. I think what it also helps us to do, again, is it helps us to tell a more complete picture. As we know, the media often reports on gun violence, and from my perspective, it's more around the mass shootings and the way that we don't have much control on how those stories are told. But I think this database, again, in our advocacy efforts, it helps us to reshape the way the story is told and use it from a factual stance. You know, there are some laws that have been enacted, some that have been repealed, and once we overlay that with the gun violence data, I think it helps us to get more credibility, and it adds to our anecdotal stories and just some of our experiences as practitioners. And so I'm hoping that would hopefully help to shift the culture of violence and how violence is portrayed in not only in the media, but within the states as well. And I would say, irrespective of our stance on gun violence, which is often a very politicized issue, which it shouldn't be, we should really focus on the facts and evidence. But I think what this database helps add to is that we can all agree that guns kill people, they injure people, and disables people of all ages, and particularly disproportionately it impacts young people. So I feel like that's an area of common ground where we can all lean from, and this database helps to add to that. I think another critical important point to point out is that the translation of these data is going to be critical as well. In the promotion of the webinar, we talked about engaging the general public, and I feel like as practitioners and researchers, we'll have to work in concert with the general public in helping them to understand how these data matter to them in their everyday life. I think if you look at any polling, you'll see that there's overwhelming public support for policy and for laws, and I think this is adding to that conversation and helping those who support laws and policy to figure out which laws they should be supporting, which policies they should be supporting, and this database provides the evidence to do that. I can stop there. I know we want to have some time for some questions.
Great. Thanks so much, Mighty. That was a great start, and I think there are some more questions where we can get a little bit deeper into some of the nuances of this piece. You and Mike actually both talked a little bit more, or you both spoke during your comments about culture and the need to change the culture and shift the thinking and the discussion. Right now, it's really it's such a polarizing issue, and really it's really a focus on the criminal aspect and the issues of dating back to the Constitution and the right of people to carry guns. But we know that, as you mentioned, Mighty, there are issues of violence and homicide, but there are many issues just of accidents and of self-inflicted gun wounds as well. In fact, there are over twice as many gun-related suicides than homicides. And so actually, if both of you maybe could speak a little bit more in depth about sort of how do we shift that conversation from one that has been so political and polarized to one that is more about, really creating this culture of creating a better discourse and a culture of sort of health and safety and respect among the various parties.
Sure. So one thing I'll start out by saying, and I think Gary Slutkin is probably the leader in this area of thinking about gun violence or violence as an infectious disease. And if we were to think about it in that same regard, as Mike mentioned before, there's such a variance in laws across the states. So there's some that had, I think you mentioned 3 or 4 laws, to some that had over 100 or provisions. And if we thought about that in the context of an infectious disease, right, which in my perspective I look at violence and gun violence as, that would not be political, right? We want to save as many lives as possible if we knew how we could do that. And I think what this showcases is we know how to do that. We know prevention works. We know that gun violence is not inevitable. From the limited research we do have, we know that guns have not been shown to be protective in homes as people have been misled to believe, right? We know children are more likely to access those if they're not properly stored, and then we have unintentional shootings. So I think that, to your point, if we really focus and hone in on the evidence, because evidence essentially is what drives policy, and I think what these state laws do, they add to that body of evidence that showcases that this is not just by happenstance, and if we know what laws are working, and we know that prevention is possible, we know that the incidence of gun-related injuries and death are decreased with strong and comprehensive laws, that's what we should be able to lead with, and that should be the message. And political beliefs aside, because this should be an apolitical issue, because it's really about preserving lives, especially if we think about those who died, whether it's by homicide or suicide at young ages, and they are not given that opportunity to live their life to the fullest potential.
Yeah, and Mike, do you want to add a little bit? I know you've talked quite a bit about this being really the impetus for your research to begin with.
Yeah, sure. So I think that there are some important aspects of looking at culture that can help us to kind of, I think, get away from this political stalemate. And I think one aspect of this is really trying to better understand what gun culture is all about. And that's something that is also a big part of our research, understanding what guns, the meaning that guns have in society. And part of this means really listening to gun owners to understand what gun ownership is all about. And if you think about a disease like, or a behavior like public health problem like smoking, we did not view smokers as the enemy or think that smokers are bad people or irresponsible people. I mean, smokers are really the victims of tobacco industry marketing. And so a lot of our ability to come up with interventions to promote smoking cessation really came from talking to smokers and having a better understanding of what the smoking addiction is all about. So I think in a similar way, we in public health can learn something from gun owners by talking to gun owners, understanding that not viewing gun owners as bad people or as the enemy, but really looking at this from a public health perspective. And in the public health perspective, we don't view citizens as being part of the problem. It's more of a societal problem. And so I think that the gun lobby has done a great job of trying to pit groups against each other, to pit public health against gun rights. But the reality is that that's an arbitrary divide. It's really a question of the industry trying to sell a product versus the rights of all citizens to a safe and safe environment, secure environment, and at the same time protecting people's rights to own guns and to get the value that they get out of gun ownership. One of the things that we're finding in looking at the laws is that these laws really have nothing to do with any of those political issues that have been discussed. Pretty much all of the laws that we're looking at have to do with keeping guns out of the hands of people who have criminal records, people who have actually committed crimes particularly crimes of violence. And so one thing that we've learned is that it is not at all incompatible to reduce firearm violence and to have policies that keep guns out of the hands of people who have a criminal record or who are at high risk for violence, and preserving the rights of citizens to own guns. And so we think that there can be a profound cultural change that takes place.
Great. Yep. And we're definitely right there with you, really thinking about the broader context of the culture. Obviously, that's part of the Robert Wood Johnson Foundation's overarching mission and views right now. And this is I think, critical issue to start putting that into practice. Sort of along those lines, thinking about previous public health issues that have also been polarizing, and really people initially felt like attempts for regulation were really flying in the face of their right to make personal choices. And I know you both, Mighty and Mike, have extensive public health experience in other areas besides gun violence. Can you think of some lessons that we might apply from other public health campaigns? And I think specifically about how we use data like this to influence our nudge shifts in policy or practice.
Well, I think that there are a lot of lessons to be learned from the tobacco control movement. And there are a lot of similarities in that in both situations there's an industry that is very powerful and has a lot of political clout. And a couple decades ago, people were saying that the tobacco industry has complete control of Congress, and Congress has never passed any legislation. There's nothing we can do. but that's completely changed. We now have comprehensive regulation of tobacco. And one of the things that really made a big difference was having data and having studies that showed that certain types of interventions were effective. And it really started at the local level. Lots of cities and states began passing laws, especially to protect people from secondhand smoke. And that led to a complete change in the culture. And it also allowed for the collection of data to show or to determine whether or not these policies worked. And when we started to see dramatic effects of these policies, we were able to go to Congress with these data. And that was really what led in 2009 to the passage of this comprehensive tobacco legislation. And it was amazing that Congress, after doing virtually nothing about tobacco for years, all of a sudden in 2009 passed a comprehensive law that basically gave the FDA jurisdiction over every aspect of tobacco production, sale, and marketing. And so I think that what really made the difference there was having data to demonstrate the effectiveness of these regulations. And I think that part of the problem with firearm research is that there just hasn't been a lot of research in this area. We don't have the kind of data that we had with tobacco. Remember when I was at the Office on Smoking and Health about 20 years ago, even back then we had a comprehensive database of state tobacco legislation. And we just don't have the same type of research on firearms, and it's going to take us a little while to catch up. But I think that with the support of the foundation and with the increased attention to this issue, I think that we can get the data that is needed to really change the picture substantially.
Yeah, I would agree. I was going to mention the tobacco example or even motor vehicles, but just picking up from what you said, Mike, thinking about the amount of time and that if I think it's maybe not correct here, but about 70 or 71, and that's when the Surgeon General proposed a federal ban on smoking in public places, right? And so that was met with much aversion at that time. But think about from 71 to where we are now today, and thinking about the layered steps of policy that had to take place for us to be where we are. There were policies around the taxing of cigarettes, making them more expensive, banning flavor cigarettes or those that were more appealing to children, the reduction of where you could smoke, and it helped to kind of change the norm. But as you mentioned, there were more data there that we had to rely on to help make that shift. And as you noted, with gun violence, we don't have that same luxury. But I feel like although it's lacking on the federal level, there are some private industries that have invested in gun violence prevention efforts, and I think there still needs to be a continual push on the federal level to advocate for change, not just for the changing of the laws or implementation of them, but also providing resources to continue to research so we can continue to build to this body of evidence so we have an even more comprehensive picture of the state of gun violence and what works to prevent it.
Yeah, and Marty, sort of thinking now about the current political context and how data can be used to inform the policymaking process, do you see either opportunities, challenges, differences in political landscape that you think are important to take into consideration given this issue and the times that we're currently in?
Sure. I think, and Mike alluded to it a little bit too, I think it's important to showcase that this effort is not to take guns away from folks, right? We recognize that you have a constitutional right to own a gun. But what we're saying beyond that is that look at the data and look at the evidence and use that to inform your decisions. And I think by not necessarily comparing state by state, but because recognizing that they have their differences, but I think for state-level policymakers, it provides them with realistic model laws for what works and the language that works for them to enact similar laws in their states. I mean, if it's been effective in one state, I don't think that's a bad thing, right? You certainly can try that out, but I think that we have to be careful in making sure that our message is one of not reaction, but a more action-based approach where we're using data to inform what laws we support, what public health prevention we support in any intervention, and not politicizing the issue, recognizing that they're, moving past this us versus them kind of thinking and really using the data. So I do think, maybe I'm being overly optimistic, but I do think that there is some traction happening by using data, certainly on the local and state level, and I would guess that would at some point percolate upward.
That's actually, optimism is a great characteristic to bring to this game, especially given your point before referencing back to the early 70s. It just takes a lot of patience and persistence and keeping our eyes on the long game and mutual goals. I know we're coming about to the top of the hour here and needing to probably wrap up in just a minute. Let me, Mike, just give you the closing remarks about sort of your plans for the future with keeping the database up to date and sustainability of the utility of this data set, and sort of just maybe one or two examples of future research that you think might be facilitated by the availability of this database.
Yeah, so we plan to keep this up to date, basically continuously. So anytime a state passes a new firearm-related law, we will immediately update the database so that at any point when users are looking at it, the data will reflect the current situation. The other thing that we're planning to do, or hoping to do at least, is to expand the number of provisions. And I know that 133 is already seems like a large number, but there are new innovations all the time. Policymakers, public health practitioners come up with new ideas. And so if there are new types of laws passed that we are not already tracking that seem to be important, we will expand the database to cover them. In terms of research, there are a number of areas that we are starting to look at. So as I think Mighty said it well when he used the word overlay, I think the idea here is to overlay data on firearm mortality rates with the state law data to try to figure out which laws are effective. And there's a number of projects that we've already initiated. One of them is looking at the domestic violence laws, which I showed on the slide, that there were different types of laws. There were some that just regulated possession, some that actually required relinquishment of weapons. And so we're actually looking at the differences in intimate partner violence rates in states that have each of those different types of laws to see whether the specific provisions actually make a difference. And a second thing that we've started is looking at those non-discretionary concealed carry permits, looking at rates of handgun mortality in states with and without those laws to see what effect, if any, those laws have on firearm violence. So I think that and our hope is really we wanted to make this publicly available because we want to allow other researchers to do this research as well. So we're hoping that other researchers will come up with their own ideas of certain types of laws they want to look up, certain policies, and we'll be able to use this database to do similar work.
That's so great, and it sounds like still lots to come in the future, more data and information to inform our work. I want to thank you both, Mike and Mighty, for joining us today to talk about this really important work and data. There is more information on our website at www.evidenceforaction.org, and of course the website that Mike was describing, statefirearmlaws.org. There are a number of additional resources available through both of those websites. The report that Mike mentioned, state fact sheets, there's an article that was recently published in the American Journal of Public Health, and a short video interview with Mike there as well. So we encourage you to visit both websites, and also to feel free to reach out to us and connect with us through these other mechanisms to learn more about Mike's work and other work that we have funded. Additionally, if you are interested in learning about how to use the database to conduct your own research, we're hosting a second webinar next Thursday, June 1st, same time, 10 a.m. Pacific time, where Mike will really provide more of a tutorial about how to use the database for research. So thank you for joining us, all of you, and let's continue this important work.
Thank you.